helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm your host, Jen Lennon. Today I'm joined by Dr. Andrew Hall from the Studio for Exceptional Dentistry. Welcome, Dr. Hall.
Good morning, Jen.
It's great to have you here, Dr. Hall, because you always have wonderful tips for us to keep our mouths healthy and fabulous. Straight teeth, though. I know I spent some time in braces as a kid,
Right.
but it's something that really is accessible to everybody, even when you're older, and there's some great options out there, right?
Right, and one thing we just want to talk about was a product called Invisalign, which
Okay.
is kind of a clear alternative to braces.
Right.
So it allows us to do traditional orthodontics, but without brackets and wires, as most people are maybe most familiar with.
Right. Now, I think people might have heard of Invisalign, maybe seen, print ads or something like that, but sort of explain the process. How is it different than traditional braces?
Well, the difference is basically, it's no different in the format or the way we move the teeth. It's
Okay.
just I guess the means to do it is those clear aligners that you see advertised. So Invisalign is a sequence of aligners, is what they call it, which are clear trays which you wear, which you sequence through, which then move the teeth in the prescribed format that we decide is the most beneficial to the patient.
Okay, so we can sort of see here, this is kind of an animation of how over time each one of those aligners would straighten the teeth. Is that the idea?
It is, and all those are pre-manufactured. So when the patient comes in, we take a set of impressions, we send that to Invisalign. They do a complete treatment plan so we can actually visualize the before and afters, and then all of those aligners are manufactured, sent back to us so we can start the sequence.
Excellent. So folks would come in to visit you to know how often to change, or is that kind of a set schedule?
It's kind of a set schedule. We only see patients about every 6 to 8 weeks, so it's not a
wow.
huge time commitment. So we'll hand you about 3 or 4 sets of these aligners, and then we just want to see you to track and make sure things are actually working the way it should be.
So that's certainly a big difference because, the time is obviously a big deal, especially for adults to get in and make those appointments. So once every 6 to 8 weeks, that's not bad.
It's not bad, yeah. It's really not bad, and that is most people we see doing it are adults who maybe had orthodontics as a child. They maybe have some relapse and they want to get things corrected, or a couple's teeth here that have moved but that they just would like to have fixed.
And who else would this work for? Is this applicable to teenagers?
It is. Invisalign actually has their own product called Invisalign Teen, made specifically for teens. And a lot of people in the past may have thought that there was a narrow group of people that fit into being able to be treated with Invisalign, but in the 9 years that I've been working with them, they have changed their formats and everything. So now really it can almost treat anything, to be honest with you, Jen.
And then in terms of wearing it, obviously if it's an aligner that goes in and out, you can take it out for a period of time. I mean, how does that work? When should you take it out and why should you take it out?
Right, so we're looking for 22 hours a day of having it in your mouth is what we're asking. So that gives a couple hours. Most of the time we're telling patients when they need to take it out is obviously when they brush, when they eat, and then if they drink anything super sugary or whatever, we just have them take it out. But otherwise we do need it in. But it is nice because patients can go about their social lives and stuff with it out if they need to.
Right, if you had some big important presentation or a performance or something, you could pop it out if needed, right?
You could, but you'd be surprised. You probably walk by people who are wearing them and you never even noticed, because really, it isn't that noticeable with patients in treatment.
And you don't hear a difference in speech or anything?
You don't. After about maybe an hour or two after wearing them, patients don't have a problem.
Okay, so if people are intrigued, because I'm intrigued, what's the first step? How do they get going?
Just come in for a complimentary consultation where we just take some photos, digital photos, and then we sit down and we can kind of give you an idea of, okay, here's a time frame of roughly what it might, how long you might be in treatment. And then from there, obviously, we can discuss cost and everything else.
Excellent, thank you. Thanks for joining me today and every day. I'm your host, Jen Lennon, for momseveryday.com.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.